Bismillahirrahmanirrahim. Let's see the episiotomy. Episiotomy is a planned surgical incision on the perineum and the post-vaginal wall during the second stage of labor. So we need to discuss there some indication, some mother indication, there are some fetal indication. Okay, and we discuss their types. So let's see. So here is there are two types of actually the episiotomy. One is the mediolateral types, okay, in this way, and other is the midline. Okay, so this you can see mediolateral, and other is the midline incision. So there are two types of the episiotomy: mediolateral and the midline. Here is the comparison of the mediolateral and the midline episiotomy. What is happening in the both cases? In the midline, it's easier to repair, less blood loss, less scarring, less pain, more charismatic, but there are a lot of beneficial points, but it's less safe. Why? Because if you do the midline, it can reach to anal, so it can damage the anal sphincter. So that's why it's a more dangerous as compared to the mediolateral. So that's why I would prefer the mediolateral, okay, because of it may involve the anal sphincter. So because of this the safety risk, so that's why the mediolateral is most commonly used. Okay, so what are the indication for episiotomy? So we look for the maternal as well as the fetal condition. In the maternal, so number one is a rigid perineum. Perineum is a rigid, so there is a risk of the perineal tear. Okay, if you do not cut, so the perineal tear which may lead to the anal sphincter. Okay, so other is the usually in the instrumental delivery, especially in the forceps. So the risk of the perineal tear. So that's why we go for the episiotomy. So what perineal tear? There are level of some the perineal tear. So if you look at here, so you can see this perineal tear due to forceps, okay, so which may lead to up to the anal sphincter. So first degree, second degree. First degree is limited to skin, and second degree it crosses the skin and also involve the muscle, and the third degree involve the anal sphincter. Okay, in the fourth degree it may lead to the rectum. So that's why there are risk of perineal tear. We go for the episiotomy, and there are some fetal indication like macrosomia, big baby, and the male presentation or male position of the baby, and the prematurity, shoulder dystocia. So that's why to prevent from the fetal distress. So we go for the episiotomy, and prolonged lead deacceleration, the bradycardia, fetal bradycardia during the active pushing. Okay, so these are the maternal and fetal indication for episiotomy. Okay, in the complication, of course, local pain or swelling may occur, and there is anal sphincter rupture. So it's most common in the midline. So in the mediolateral, so it's safe. Hematoma, which can cause an infection. There is also complaint of incontinence, urine cannot be controlled, or painful urination later on. Okay, sexual dysfunction for short term, not long term. Okay, so what are managements in the steps? If the pain after episiotomy, just suggest go for observation and ice bag and paracetamol. So initially give this. If there is a hematoma, you see if it's a small, just observe this condition, and if it's a big, then remove that the blood and give the IV fluid. Okay, so this is all about the episiotomy. Thank you very much. Allah Hafiz.